name is Megan Pizzella. I'm a registered nurse and I work on Cambridge 8 ICU. I asked a few of my coworkers to describe what they're experiencing on the inside, and some of the words that they used were exhausting, depressing, inevitable, preventable, and emotionally depleting. And those are the things that we are seeing with this patient population. It's just very stressful on us.
I'm Audra Estes. I'm a registered nurse on an inpatient COVID unit at the health system. We have overcome incredible challenges, faced danger, and faced even secondary trauma as we have cared for these patients.
My name is Dr. Christopher Brown. I am an internal medicine physician here at the healthcare system. I function as a hospitalist, and my primary roles are to round and take care of multiple different type of patient populations. I've taken care of hundreds of different COVID patients. From my perspective, the patient could no longer see my face. The patient could no longer have family members present. I actually had a patient that said they don't necessarily remember me, but they remember my voice.
My name is Zara Mahmoud Jafari, and I am a clinical pharmacy manager for hematology, bone marrow transplant, and cellular therapies. Our patients are the most immunosuppressed in the entire health system. We have banded together in 2020, we banded together once again in 2021, and then now in the heat of this most recent surge, and more challenges than we've ever anticipated. Now with our own staff falling to COVID and having to work from home, we've really met each and every challenge with one another.
We have been working together as a team to provide excellent care for these patients. We have been having different nurses deployed to different areas who don't normally work there to deliver trays to our patients so they can eat. I have seen nurses in lab coats scrub and clean our floors for housekeeping. We are all just working together to get the work done as a team.
I am so grateful for my team. I am confident of how myself and my coworkers have stepped up every single day to care for this community, to serve it well.
For me, the COVID-19 pandemic has confirmed that we are flexible. I don't really care for the word resilient. My preferable word is the word perseverance, because despite the number of challenges that we've had with every year the pandemic has offered us, we have persevered above that.
I had one day where I had 3 people die before 9 a.m. before even having my coffee.
Honestly, what's happening on our units at this point is unsustainable for our staff.
And he's got his wedding ring and his watch and his hearing aids. We should just keep those with him, I think.
They expected to have so much life to live, but yet they're down here in the morgue. We have to take this serious. We have to know that life is very short.
One thing we know is that with this vaccine, the literature, the data, the information has made it very clear that it can level the playing field and lowers your ability to be hospitalized, have severe complications, and/or die. One thing that we can do as a people is figure out a way to just come together, remove ideologies, remove personal beliefs, and just realize again, going back to the data, if we can just continue to just get people vaccinated, that would help the most.
It's such an interesting dichotomy to be working on this inpatient COVID unit and then to clock out and leave and go to my community where hardly anyone in the grocery store is wearing a mask. And what I would like to see in our communities is an increase of masking, testing, and vaccinations, because what we're seeing is largely preventable if we're implementing those resources.
Just knowing what we're going through is not our normal. Your support and honestly your prayers would be very beneficial for us as healthcare workers.